Welcome to Periop Talk. I'm Dr. Lisa Spruce, Senior Director of Evidence-Based Practice at AORN, and I'm pleased to welcome Amber Wood, Senior Perioperative Practice Specialist, to discuss our guideline on packaging for sterilization. Amber, welcome to the show. Let's get started.
Welcome to Periop Talk, making surgery safer one podcast at a time, with brief, practical information for you to take back to the OR.
Amber, tell us what prompted the review and update of the packaging for sterilization guideline.
Yeah, thanks. So we did this update just on the heels of the update to sterilization. So we wanted to make sure that those were updated together. And we knew there were some important issues, especially in quality around sterilization packaging systems. For one, we were concerned about packaging defects and we are concerned about personnel discomfort. So we wanted to address some ergonomic concerns there. Another thing is just the quality of the use of the pouches and the presence of holes in sterilization wraps and filters. So we wanted to make sure to take a good look at that and emphasize that. And then we just had a ton of new quality improvement initiatives published that talked about streamlining instrument sets. And so we knew we wanted to address all of these things in the update.
Okay, great. So who was involved? Who were your key stakeholders that were involved with the update?
Yeah, so we worked closely with Guidelines Advisory Board, of course, our nurse members, and then our liaison organizations. And the Healthcare Sterile Processing Association, HSPA, was very engaged with this topic, as well as our infection prevention colleagues from APIC.
Yeah, nice. What's the overall goal of these updated guidelines?
Well, we want to prevent infections and we want to make sure that we are protecting the integrity of those sterilized contents that we work so hard to achieve sterilization. And we want to make sure that we maintain that until it's time to use those instruments.
Yeah, I think this is a really important topic for periop nurses because I don't think we always understand what goes into packaging for sterilization and the different nuances of that. So, what is the most significant changes that you made to the recommendation when we're selecting and using those materials?
Yeah, Lisa, you mentioned how complicated this is. There are whole like packaging engineers that their whole degree is coming up with the sterilization packaging system. It's incredibly complicated. And some of the important things, I mentioned ergonomics. That's a big change we want to make sure we're addressing, and some facilities may already be there and others may not be. So we wanted to make sure we're addressing our work surfaces being at a comfortable height and having a safe place to sit that's adjustable as well for those ergonomics, making sure we have space and room to assemble our trays, which is a big challenge, making sure we have adequate lighting so you can see what we're doing, and the anti-fatigue mats so people aren't uncomfortable if they're standing, and then limiting noise because these areas can be really noisy. So we wanted to make sure we address those ergonomics. So those are some new things. The other thing is making sure that we're inspecting all those single-use wraps and filters while we're putting the sets together, that we're checking those things before we use them. And then looking at this new guidance, there's several new recommendations around streamlining instrument sets and optimizing them. And basically, you're looking to see which instruments in our set are we not using? Can we take them out so we can kind of streamline our processes and save some time and eventually saving money too, right? So,
Yeah.
but all those things are important to providing better quality care. So, those are the big changes in this guideline.
Yeah, that's great. I think as a periop nurse, I didn't get a lot of time in sterile processing, but when I did get to go in there, I was always fascinated at their process and how they did things. And I know that there's some recommendations for the technique, so packaging technique that were updated. Can you talk a little bit about those?
Yeah, well, specifically around pouches, the peel
Yeah.
pouches,
Yes.
paper plastic is what we're talking about. So we added recommendations to emphasize how to correctly use those and following your IFUs and making sure we're not putting items that are too big and trying to fit it in a pouch that's too small. It can cause problems. And then checking the seals and making sure they're completely closed and smooth. And we're very clear, no gaps, no folds, bubbles, or wrinkles. All of those things can compromise sterility. So we want to make sure we have good technique there. And then for the heat sealers, if you're using pouches where you seal the peel pouch closed, that we're using those heat sealers according with their instructions. And they have different temperatures depending on the material of the packaging. So you have to make sure it's set on the right temperature. And then we need to make sure we're maintaining that equipment. Otherwise, you're not going to have good seals. And
Yeah.
so those are the big recommendations for the technique.
Yeah, that's very good to know too. How can healthcare facilities effectively implement the updated guidelines?
Yeah, thanks. That's a great question. Implementation is always a challenge, and I recommend starting with the small wins. Do what you can accomplish quickly without external resources. And right, just looking at where we have gaps in our practice, what do we need to work on first? And I think a great thing for like the peel pouches is to do some audits. Just get out there and look at your pouches, collect some internal data, right? Get your eyes on them. Where are we having issues? Review the IFU of those pouches and the items that you're putting into pouches, and coach your team. Give just that just in time coaching, looking at the seal quality and the type of items were being packaged. And it's important for leaders to listen to the frontline team. Like the people who are doing the work know how to improve the process. So listen to them. Maybe you need different sizes of pouches. Maybe some of the items need to be moved to a rigid container or a wrapped tray. Those things are going to take resources. So work with leadership to transition those items to get you into compliance and making sure that you're following the IFUs.
Yeah, so important. And you talked about the challenges of implementation. Can you talk just a little bit about what those are?
Yeah, well, any challenge with change is just going to present challenges by our human nature, right?
Yeah,
Humans are
yeah,
just resistant to change. And so it's really important to communicate early and often, and with everybody who's going to be impacted. So I mentioned those quality improvement initiatives. They were streamlining instrument sets. That's something like you don't want to just take that on without involving the team. Like sterile processing can't just start streamlining sets without involving the team who's using those sets, right?
yeah,
So it was really important to convene a team and get everybody who's involved, every user of those instrument sets involved, and all your key decision makers. And maybe like for sterile processing, your customers are outside of the OR. Maybe you have other departments that use the sets. So get everybody involved, get their input to look at, what's your instrument utilization, and just make decisions. What instruments can you remove from the sets? And like pretty much all of these papers talked about how important it is to have a surgeon champion anytime you're doing that, because you need somebody to be your cheerleader and get the other surgeons on board. So they talked about how that was essential to being successful. And then another thing that's successful to help with these challenges is to show the data. Show me the data. Look at your instrument utilization data that will guide your initiative. So, how often do you use this instrument? Some people used apps to track utilization, some just with a clipboard and a piece of paper, just tracked how often they were using it. And many of the studies, they said, okay, if we don't use an instrument 20% of the time, it's on the chopping block. Maybe that's an instrument we take out of the set. And so those decision makers, that showing them that data is really going to help when you can show them, hey, we've used this 1% of the time. It could be moved into a pouch so we don't have to have it open every time. And that's really going to help you with implementing change.
yeah, yeah, I love that. And you've talked a lot about quality, and when I think about quality, also think about patient outcomes. So can you talk about how these guidelines could potentially impact patient outcomes?
Yeah, so the biggest issue here that I've been talking about that was a concern for us is those packaging defects. They can compromise the sterility of the package and all that work you did to make sure it was sterile, and you have a hole in your package or you have a gap in your seal and it's not sterile anymore. And so that puts the patient at risk for infection. That's the ultimate outcome that we're trying to reduce.
Yeah, yeah, makes sense. And then talk about a little bit about how you think these guidelines might evolve in the future.
Yeah, it seems like every day there's a new sterilization technology or new materials are coming out. So we're absolutely staying up to date, being involved. in what's going on in the industry and making sure we're addressing these new materials like the 3D printing and those different technologies as they come out, and make sure that we're updating the guidelines so you have the latest and greatest and you know what's evidence-based when you're selecting and using these packaging systems.
About sterilization for packaging.
Awesome. Thank you so much for having me.
Yeah, it's been great. So thank you all for joining us today. We hope that you've also found this to be a helpful discussion. And just as a reminder, this guideline is available now in your eGuideline Plus subscriptions and in your 2025 print guideline book and ebook. And that's it for today. See you again on Periop Talk.
Enjoyed the episode? Please like, comment, and subscribe. For additional Periop content, look for us on Instagram at AORN Pics and on Facebook and LinkedIn at AORN. You can also find us at aorn.org. Thanks for listening.